community, and it could have helped those people at the same time.
Now, I'm still trying to fathom how a $940 billion health care reform bill can reduce the deficit by $138 billion over 10 years.
Yeah, we'll get in line. Only Washington thinks it can spend $1 trillion and save money. It's impossible to do that. If you look at how this Congressional Budget Office scored it, they never took into consideration that in the Balanced Budget Act of 1997 there were supposed to be incremental reductions in payments to physicians. That was all supposed to, for the purpose of making everything more cost effective, etc. Well, those reductions have always been delayed. They're now at about $220 billion that is really owed to the physicians. So if you take that $220 billion and add that to the health care bill, this bill will come up in the whole hundreds of billions of dollars in debt.
The vote last night was 219 in favor, 212 against, 34 right. Democrats, including your colleague Dan Lipinski from Illinois, voted no. Not one Republican voted to support this bill.
Right.
Doesn't that underscore how partisan an issue this is, Don?
Yeah, the only bipartisan vote were the 34 Democrats that joined all the Republicans to vote against this monster. And then the way it came in the end, Ken, is that Bart Stupak from Michigan, instead of standing on his principles and saying, this bill will result in federal dollars for abortions, and by about 80% of Americans, including pro-choice and pro-life Americans, simply do not want federal funds used for abortions because it's wrong. It's so intimate a thing that they believe that money should not be used for it. He went to the president's office and exchanged for a piece of paper that's worthless, something called an executive order, ended up selling out. And it was his votes that made the difference on it.
Now, my understanding of this, Don, this comes from one of the Chicago papers. The bill tries to maintain a strict separation between taxpayer dollars and private premiums that would pay for abortion coverage. No health plan would be required to offer coverage for abortion. In plans that do cover abortion, policyholders would have to pay for it separately, and that money would have to be kept in a separate account from taxpayer money.
Well, it doesn't work that way because, first of all, money is fungible. It's hard to tell where dollars are coming from. Second of all, you're still going to have subsidies that are going to small business people and to individuals who will take the federal subsidies and use those to purchase the so-called optional abortion coverage on it. So it's still federal money that's being used.
Does this bill have any impact on your health insurance and your colleagues' health insurance?
Well, it's interesting. I have the federal health employees benefit insurance. Our premium each month is around $500 a month. It's Blue Cross Blue Shield standard option. I mean, this is not the a lot of people think that we have insurance that differs from most people in America, and it really isn't. It's the most common insurance, I think, in America is the Blue Cross Blue Shield standard option. What it does do, I think, it will add an adult child up to age 26, so it goes from 22 to 26, and that's about it. But it's it's very high deductible, and as I said, it's the same policies that most Americans have at their place of work.
But you call the bill that was passed last night, 219 to 212, a disaster.
It is. It's a financial disaster. The big story is not the health care bill. The big story is what Blomberg reported, and that is that the bond market is saying it's safer to lend to Warren Buffett, Procter & Gamble, Johnson & Johnson, and Lowe's, which traded at lower yields in recent weeks than it is to lend to the federal government. I mean, that means that foreign investors believe that private bonds are safer than U.S. Treasuries. Ken, that's shocking. That's shocking, because that's how the United States will eventually lose its AAA bond rating and make it more expensive to get money on the open market, and make us even more dependent upon the Chinese.
What kind of feedback are you getting from your constituents in the 16th district?
Well, people, overwhelmingly are opposed to the bill. I can't give you the numbers. It's into the thousands that have contacted our office over a prolonged period of time, and but it's at least 2 to 1 or 3 to 1.
Now what?
That are opposed to it.
Now what happens?
Well, the Senate has to take up the what's called the reconciliation bill, which is, that's a spiritual term. Reconciliation is when a person reconciles his action with his God. But somehow that term got applied to this particular bill. The House last night passed the exact Senate bill, the one that has all the flaws on it. And then it also passed the so-called reconciliation bill. The reconciliation bill has to go back to the Senate to be voted on in its exact form. And when that's done, then the president will be signing a second bill. If that's not done, then if that reconciliation bill does not pass, then the union workers better brace, because they're going to get smacked with an insurance because somebody in Washington thinks that their Cadillac insurance plans are somehow immoral and should be taxed.
One of the next big issues may or may not be immigration reform.
There was a huge demonstration in Washington yesterday.
Yes.
Taking place on the Mall. Tens of thousands of illegal immigrants took the bus and train into town. Many were wearing their anklets that the federal government places on people to monitor their actions in preparation for deportation. And the people were saying, we're illegal, we're working here, they're giving their names, just defying the government to do what they should, and that is to deport them in many cases. And so the next thing coming up is a massive bill that will grant amnesty to 11 or 12 million Americans, and then, of course, give them the ability to vote in November and come in there and skew the elections. And by the way, Ken, we've been receiving tons of phone calls from people very upset with the census form. I don't know if you've seen that.
Yeah, I have. I've seen the census form, certainly.
I talked to somebody from the Department of Commerce last week. I'll talk to somebody else again this week.
Yeah.
Of course, it won't do any good. But they have some outrageous things in there. Well, first of all, it counts everybody, including illegals. It doesn't find out what their status is. But if you have a child at college, that child is not counted as a resident of your household. The child is counted as a resident of the college community, even though that child will return home in summers. And
is still a dependent.
That's correct. It's still a dependent.
Right.
And I asked that question of the person from the Census Bureau. I said, "Hey," I said, "why would you want to do that?" And they said, "Well, the child uses services in the other area." I said, "Excuse me, I paid through the nose for the college to have its own security, to maintain its own roads, for her to have food. She pays for her own cell phone, and then this is all part of bills that several states have passed, such as Pennsylvania. Our daughter goes to college in Pennsylvania, and last November she was told that she could vote in the Pennsylvania elections, even though she's not a resident there. And she said, "My father's a member of Congress in Illinois. I'm going to vote the absentee ballot." But they were told, they said, "Look, your vote will count more in Pennsylvania because this is where Mr. Obama needs the votes then in the state of Illinois. I'll tell you, Ken, I mean, it's the destruction of the powers of the states. The family is no longer considered to be a homogeneous, is that the word? Yeah, a homogeneous unit living in one household. Children are not considered, even though they're dependents, to be residents of the state where they pay taxes, where they live, where they were born and raised in most cases, but residents of the very area where they're going to college. It doesn't make sense at all.
Don, I know your time is short. We've got to go. Thank you so much for your time.
Thank you. I'm going to get some sleep now.
I appreciate it.